Hello, I'm Barbara Markham, the Director of the Senior Resources Department for the City of Westland. Welcome to Health Matters. With me today is Kathy Dattolo, who is a licensed social worker who works with the Senior ER program at St. Mary Mercy Hospital. So, it's very interesting because social workers are such an important part of our society in identifying problems. What does a social worker do in a hospital setting?
Well, that's a good question. First of all, thank you for having us. We're very delighted to be here to talk about our Senior Emergency Center. We're very excited about it.
We're excited too.
Thank you, Barb. A social worker in a hospital setting has a variety of roles. And specifically with the Senior Center, we're discovering that our seniors now, because of the new focus that we have with our seniors 65 and older, we're discovering a lot of unmet needs. For example, home environment, nutrition, medications, meals, transportation, isolation, loneliness, depression, fear of loss, independence, being taken from their home. There's so many things that we're learning now about our seniors, and every day we learn more and more. So the role of the social worker is hard for me to really pinpoint down for you, other than to say we're looking at the patient as patient-centered, and when the patient is in the center, as the patient should be always, then you're looking at the whole hub and the wheel, which is a multitude of things, because as you know, as a person, you don't stand alone. You come with a variety of things that have impacted your life greatly to bring you to this point.
Right. So, in other words, being treated medically is one part of the equation, and the social worker identifies all of the things outside that one specific medical treatment that they're there for.
Right, and certainly the medical treatment
is part of it.
It typically brings the patient into the hospital, but at that point it gives us an opportunity then to sit down with the patient in a quiet environment in our senior center, which is designed specifically to meet that need. Patients coming in are afraid, whether they've fallen, they bumped their elbow, they're having a stroke. It could be on a scale of 1 to 5. They're afraid. And I think they're mostly afraid that they're not going to be able to go home.
Yes.
People want to go home. They do not want to go to a nursing home, an assisted living, their sons, their daughters. And it's not good or bad. It's just the way it is. Mm-hmm. They want to stay independent, have their quality of life.
And who doesn't want that?
We all want that. And I think a lot of times when they come in with an injury that we're treating that, now we're able to look at the person as a whole, from when they were young to now. If you look in the eyes of any person and you take the time, you can see when they were an 8-year-old child, when they were 15, when they got married, when they had their children. And the truth is, if you take the time and listen, they'll tell you and share their story.
Now, do you deal with every patient who comes in through the senior ER?
Excellent question. Everybody that comes in through the senior center, 65 is the magic number, if you will, that gets the assessment. So anybody that has an answer of two yeses or more, I'm referred. So what I'll do is work directly with the nurse or the doctor, the tech, whoever is involved and identifies that need. They call me or send me a referral, and then I review it. And the goal is, yes, to see every patient, to meet all the needs, to find out what they need and maybe don't need, and how to best help them. And certainly if they're going home, to make sure that they've had that proper and thorough visit and assessment. So when they go home, part of our goal and my goal is to give them the tools they need when they leave, so they can go home safely, securely, and stay at home.
What kind of questions might a patient expect from a social worker if they're in the senior center?
Certainly I would talk mostly about what they're there for, And I always say, how can we best help you? What's important to you? If you're home alone, are you falling? Are you eating appropriately? Can you see to read your medications? Can you hear me talking to you? Are you steady on your feet? When you go to do your personal care, do you have to step into a tub? Do you have a shower bench? How do you get to and from your dialysis? When is the last time you went out socially? How long has it been since you've gone out to see anybody? And it's very conversational, very non-threatening. I make a great effort to sit with the patient, to give them an opportunity to have a deep breath. We offer them warm beverages, warm blankets. We can dim the light, and people really begin to relax. And often during the assessment, we'll hold a hand or put a hand on a shoulder, and people are afraid. They're scared.
Yeah, I think what you said, it hits the nail right on the head as far as people are afraid that they're going to be kept from going home. And now, and it used to be 20 years ago, the Department of Social Services, FIA now, or the Department of Health and Human Services, you know, now the whole goal is to keep people in their homes and so supply those supportive services that allow them to stay there. It's convincing that generation or those couple of generations that, you know, it's possible to do this, and there are a lot of services out there that keep them from entering a facility, and I think that's what they're afraid of. So breaking through that fear barrier and having them comfortable and allowing them to be honest with somebody just enables them to receive the help that they need to make their home life a better quality of life.
Exactly.
Now, I'm a little bit curious. Do you see or suspect any abuse cases when you have seniors come in, neglect or
Unfortunately, yes. Unfortunately, we have discovered that, and in discovering that, we're able to intervene immediately and provide a safe haven for a patient depending on what's going on. And that's a really good question. I'm glad you asked me that, because what we're seeing also is a patient who is self-determined, able to make their own decisions, not making good decisions, but being at home and not giving themselves the best care they need. So the trust building is crucial.
Yes.
So if you have the opportunity to build the trust and talk with the patient, who then is allowing the help to come into their home, immediately things change for the patient. As soon as you say, my goal is so you can go home and stay home safely, not to go in and look around and see what's wrong. As you said, social services has a lot of negative connotation, and I'm hoping that with the senior center and being involved, that will begin to change, so that view can be as a helpful view and a supportive view for people to go back home.
Well, from a social worker perspective, what do you see as the major advantages to a senior emergency room or senior center, as you refer to it, versus a traditional emergency room?
Well, I think the main asset would be the patient-centered. It's not so medically centered. It's a variety, and it's interdisciplinary, where the patient then is guiding and telling and educating us on what's important to the patient, because what might be important to you wouldn't be important to me, and how you've lived your life. And we're not going to change you as a person. We want to enhance your quality and give you what you need.
Now, when we talk about services and people who are 65 on Medicare or Medicaid, does Medicare and Medicaid pay for the services in the hospital? And do you go out, say, after discharge? And are you involved in discharge planning? Do they cover those services?
If a patient leaves the emergency center and there's a need for home care, the doctor will write the order. When a doctor writes a prescription for home care, the Medicare and Medicaid pay for it, which is very important for the senior to know, because we're looking at typically fixed and limited income at this point.
Yes.
So that's very important for people to know. So at that point, the doctor writes the order, we get a hold of the home care team, the team goes out to the home and does an assessment in the home environment. If there's a flag that a social worker might be involved, the social worker can at that point go into the home as a help to assess the home environment, possibly to get set up Meals on Wheels, transportation, assistance with dialysis clinic, senior services. I've discovered that a lot of our seniors are depressed.
Yes.
Normally functionally depressed, however, not saying or telling anybody because they don't want to burden their children. They don't want to bother anybody. But we've discovered a lot of resources that can go into a patient's home, a social worker like myself that Medicare is paying for with a copay to visit the patient unlimited. And some of the seniors are being more receptive than others, but I would encourage your viewers to really listen to that piece of it because it can be a great help. Talking to someone, having a one-on-one, a support, having someone to reach out to can really enhance your life and decrease your feelings of isolation and depression.
Yeah, I'm glad you said that because with the seniors, I see also a lot of depression, and the difference between a situational depression and a clinical depression. You know, you lose your husband, you have the loss of your friends, you can't hear as well, you can't get around as well, you can't see as well. Of course, people are going to be depressed. That is a normal response to what's happening in their life. It's not easy to grow older.
No, it isn't.
Especially when you're very independent. So I do believe that social work and intervention, as far as mental health services, can make a huge difference in the quality of someone's life. So I just applaud that. Now, would you go out and visit? Do you ever have a reason to, you said with the coordinating team, if you see a red flag, do you ever go out and visit a home after a patient is discharged?
I personally don't, although I think of doing that. but I personally don't. However, part of the experience in the senior centers, my responsibility is I do follow-up phone calls.
Okay.
So when a patient goes home, I will make the follow-up phone call within 24 to 48 hours and talk about, you got home safely, how are you transitioning, did you pick up your medication? If you picked it up, are you taking it accordingly? Is it effective for you? Are you following up with your primary care physician? If you haven't made an appointment, what's preventing you? May I help you do that? Are your children involved? Have you eaten today? Have you slept? All of those things come in conversation. Depending on the response, I can intervene again at that point while they're home and have set up home care after the fact, or have got visiting physicians in after the fact, or help somebody change a dialysis clinic, or done a home-delivered meals referral after the fact. So I'm not there physically, but via the phone I am there. Yes.
Well, I am hoping by doing this interview regarding the senior center, the emergency center over at St. Mary, I am hoping that part of the element of fear is dissuaded, and I thank you so much. Is there anything that you would like to share with the viewing audience before the segment ends? Is there anything that you think they should know?
Thank you. Yes, I really think that our senior population is very valuable, and because of them, they are really changing the way we know about, educate, and deliver our new health care. So to that, I'm going to thank them, because they're making the change again, and it's substantial, and it will impact not only them, but generations to come.
Agreed. Well, thank you very much, Kathy, and I appreciate so much St. Mary Mercy and I think this is a wonderful, innovative program. I can't wait to see. I'm looking forward to having you, Michelle, back in a year or so. Let's find out where we're going with all of this and how it's turning out, and I see nothing but success ahead. So I thank you so much for being our guest today.
Thank you, Barbara. It was really my pleasure. Thank you.
And thank you, friends in the viewing audience, for being with us today on Health Matters.